Abnormal uterine bleeding. When is it hormonal and when is it cancer? Abnormal bleeding is one of the most common and most overlooked warning signs in gynecological oncology. Hello everyone, I'm Dr. Imaan from SSO Hospitals. Women experience changes in menstrual cycle for many reasons. Stress, hormonal imbalance, thyroid dysfunction, polyps, fibroids, because these causes are common. Abnormal bleeding is often treated symptomatically. The challenge is recognizing when that bleeding is a red flag. In women above 40, especially those approaching menopause, any significant change in the cycle pattern deserves evaluation. That includes heavier bleeding, prolonged cycles, bleeding between periods, or cycles that suddenly become irregular after years of regularity. The most important red flag is postmenopausal bleeding. After menopause, the lining of the uterus should be inactive. Any bleeding at this stage is abnormal until proven otherwise. Evaluation is straightforward and usually begins with a pelvic ultrasound. We assess the thickness of the endometrium. If it appears to be thickened or irregular, a biopsy is performed. A biopsy is a small sample of the uterine lining examined under the microscope. It helps differentiate benign hyperplasia from precancerous or cancerous changes. When uterine cancer is detected early, treatment is often surgical removal of the uterus. In early stages, surgery alone can be curative. Delays happen when abnormal bleeding is repeatedly treated with hormonal pills without tracking response. If bleeding continues despite medication, further investigation is necessary. Early stage uterine cancer has excellent outcomes. Late stage disease requires more complex treatment. Important principle is simple. Treat symptoms but track response. If symptoms persist, investigate. Abnormal bleeding is often the earliest warning sign. Acting early keeps treatment simpler and outcomes stronger.